It is always a treat to be back at University Health. Some 40 years ago, actually almost 41 years ago to the month, I was born here at University Health, so it's kind of like a good homecoming for me all the time. And Charlie, thank you for letting me come back here today. We have this outstanding group of people gathered here today to celebrate something that is just an exceptional accomplishment. I have been in public office for almost a decade, but for far longer than that. We have had discussions in Kansas City and throughout the state of Missouri about how we can make sure that we're providing the necessary care that we need for everyone who needs behavioral health care in the state of Missouri, including those who are serving sentences with the state of Missouri, including those who may need access to care through whatever path they take. And I want to thank particularly our State Department of Mental Health for working closely with University Health and the city of Kansas City and making sure that we could get to this great moment today. I first want to acknowledge and recognize my colleagues on the City Council who are here with me today from the 4th District at large, the district in which you are sitting, Councilman Crispin Rea. We have Councilman Darrell Curls of the 5th District at large and Councilwoman Lindsay French of the 2nd District at large, and from 2nd District in District on the side, what Councilman Wes Rogers, who's with us. If I forgot anyone, we love them all too, but we'll get them there. Oh, I did, yeah. Cool and sitting in a row all by himself is Councilman Jonathan Duncan of the 6th District, South Kansas City. He wanted like his own shout out, so thank you for being with us. I also want to recognize particularly a number of folks from our Kansas City staff. Every day it wasn't necessarily easy for us to make sure that we worked out the real estate obligations, some of the other contractual issues that we needed to arrange. So to all of you who toiled for some time throughout this project, I want to thank you. From discussions about real estate to so many others, this was something that was a labor of love for everyone at City Hall. And I also want to make sure I recognize our partners at the Department of Mental Health. When we were talking about this project, it went through a number of different stops and starts. We needed legislative action, so thank you to our friends in the Missouri legislature. Ultimately, we needed the support of then Governor Parson and so many other leaders in our state. And you just said, we got this, which frankly, I don't know if I believed you along the way, but I was like, all right. This is like giving the ball to Patrick Mahomes with 13 seconds left. So somehow it will work out, and Valerie and your team did an outstanding job with it along the way. But something that was consistent throughout was that we were all committed to recognizing the need. At no point did we ever depart from knowing that this was something that wasn't just necessary, wasn't just helpful, but is essential to being a city that is growing and that is strong. One that invests in behavioral health care, one that has great partnerships with our leading healthcare institution here in Kansas City, Western Missouri, and this entire region, and University Health, one that works with our state and certainly all of our localities, not just Kansas City. I also want to recognize the many people who interact with folks here and elsewhere, those of you who are dedicated to care in our community. To all of you who are social workers, nurses, providers, staff, law enforcement officers, parole officers, and probation, so many more. Thank you for caring so much about our community. It is often discussed how we have not invested enough in behavioral health care in our country over recent generations. Today, Missouri is truly a leader. Thank you to Valerie, to Charlie, to so many for making us leaders in this important, not just discussion, but in making sure that we have true care for everyone. The way our real system works and the way our city gets better is we invest in all parts of behavioral care, and we make sure that we know that building better lives for people is what builds a better community long term. So on behalf of all of us at Kansas City government, I want to say thank you so very much. I will note that I did not take any of his lines because I'm going to introduce next our city manager, Mario Vasquez, to talk to you more about this project. Mario.
Thank you, Mayor. Thank you. Good morning, everyone. I want to thank Mayor Lucas for the introduction and for not taking my lines. I would also note that it's one of the toughest acts to follow when you get up. You can speak after him. But I do want to once again echo and thank the staff from the city of Kansas City, Missouri. Many of them worked for many months to bring this project to reality. When I met with the leadership of University Health a few months, almost 24 months ago, it seemed like a daunting challenge to try to get to where we are today. We had We're looking for site, the right size, the right location, right access, all things that are necessary to make sure that we can provide a facility that is accessible to those who have the need. And so specifically want to name Morgan Halchuk from my staff who's here, and other folks, Andrew Bracker, Abby Judah in the law department. They really helped us overcome a lot of challenges with the site. And also want to acknowledge the partnership that we had to enter into with the Housing Authority and in trying to secure the property. The relationship that we established with Kansas City Public Schools, that had also an interest in the property, and they were very gracious in granting us access to it. So all of that is going to lead us to transformational investment for this part of the city. That is going to generate $6 million a year to the Kansas City economy, $60 million a year to the Kansas City economy. It is truly one of those things that, again, aside from the economics and the service to the community is significant. This site, we toiled over this site for over 6 years trying to figure out what is the best and the highest and best use for it. And finding all the challenges, we really did find that it was just the right place, the right location, the right access, and also creates an opportunity to establish opportunities for for continuing education and learning for for the students at KCCU. So it's a great effort for all involved. The project is going to take about 3 to 4 years to complete. We're expecting an opening in 2028. And so I'm very excited to see this go forward. Everybody that knows me knows that, I'd love nothing more than to see outcomes. And so this is going to be a great outcome altogether. So with that, I'm just going to turn it over to Valerie from the Department of Mental Health. So thank you, everybody.
All right, thank you all for joining us. This truly is a historic moment in supporting mental health care for Missourians. I know it's not time yet, but I am so ready to get a shovel in the ground. This is the first time in the history of modern mental health treatment that the state has built a new facility to increase our capacity to serve more citizens in need of evaluation, treatment, and care. Thank you, Mayor Lucas. Thank you, Kansas City City Council members. Thank you, Mario Vasquez, City Manager. Thank you, the team members from both the Mayor's office and the City Manager's office. I have their phone numbers in my cell phone now. So we have really spent 16 months working through all the different hurdles and challenges and new exciting opportunities that we didn't know were going to exist to get this far. So very, very, very grateful for all of those partnerships and new friends. Today, just so you guys understand kind of our footprint, the Department of Mental Health operates 65 beds in Kansas City at the Center of Behavioral Medicine. You can see the backside of it right over there. Adding this hospital will increase the Department of Mental Health's capacity in Kansas City to 215 beds. This is a very significant investment. We will expand our capacity across the street here from 65 beds to 115 beds to support individuals with longer-term mental health needs so they have a place to stay and get the treatment that they need. Our part of the new hospital will support 100 new beds for individuals committed to the Department of Mental Health for competency restorations by the courts. Today, 460 Missourians are in county jails waiting for an open bed in DMH to support their competency restoration. DMH and the University Health have been partners for over 19 years in offering inpatient supports. Thank you, Charlie Shields and University Health team, for your commitment to that partnership and the support for growing that partnership with this new facility. We could not be here today without your hard work on this facility. Together, we've made great strides in expanding access to quality care for those facing the challenges from mental health and substance use disorders. Also, to keep everyone up to date on the progress of this facility, the state and University Health are maintaining a webpage called kchospitalbuild.mo.gov. So look for more information on that coming soon, like maybe a shovel day. That would be great. So thank you all very much, and thank you, Charlie. And I will bring you up here. Thank you.
Thanks, Valerie. It's a great day. So I want to go back a little bit in history and kind of talk about some givens that are out there. We know that, as Val mentioned, the need for behavioral health services in this area continue to grow, and we need capacity to meet that need. If you go back, to the 80s and the 90s, we saw capacity for inpatient services dwindle. Not just in the state, across the country. There were some decisions that were made that seemed like the right thing at the right time, but that created a challenge, and now is the time to build back that capacity. So that is exactly what's happening here. It's what our community needs, it's what our state needs, and it's the right time. As Valerie mentioned, our side of the facility, we go from 50 beds, and frankly, we can't open all 50 at any given time, to 100 beds. That's a big deal to be able to increase the size of that capacity for short-term inpatient needs. Then the other thing that we've lacked for more than a decade is behavioral health emergency departments. So a place when people are in crisis, when EMS, when law enforcement has somebody with emergent needs and crisis, they can bring them to that ED. We'll make sure that they have the right place to go and get the right care they need. We talk about the impact this has on Kansas City, but it's not just Kansas City. This facility will serve the entire western side of our state. And it'll serve the needs for the citizens of the entire state, but particularly on the western side, so that's a big deal. Another thing that should not go unnoticed, it's part of University Health's academic mission. So we describe ourselves as two things. We're a safety net hospital. We're the only one in the state, but we're also an academic medical center. So we train, the physicians of the future, the psychologists of the future, the nurses, the social workers. All those folks get trained here. So this facility will fill that need too. So not just are we serving that population, but we're also providing capacity of those professionals into the future. And it is not an accident that our neighbor is Kansas City University and Dr. Mark Hahn. So they are along that same mission trying to do the exact same thing. So this will be a perfect fit. And that's why this site is so really, really good. So Dr. Hahn, thank you for what you're getting ready to, what you did to make the site available and make everybody aware of it, but also what's going to happen in the future. So thank you.
The need is great.
So it's also a job creator. It supports 600 jobs. So there is, Mario mentioned, there's absolute economic impact to that. And then what is particularly exciting is, these don't happen with just University Health. They don't happen with just the state. They don't happen with just the city. This is that true partnership for all levels of government coming together to do something right for our citizens. So we appreciate that. So I want to say, thank you to the mayor, thank you to our city manager, the council members that put this in place, the Department of Mental Health, the state legislators. We've had two governors involved in it, Governor Parson, Governor Keogh, that made this a priority. And we've had extreme leadership from our appropriations folks, Senator Lincoln Huff and Representative Dirk Deaton, the budget chair in the House. So everybody came together to make this happen. This is not easy stuff, and that's why this is such an important day. So the person in the department that is going to actually get us the shovels in the ground and get it built is the Office of Administration. So I would like to introduce Carolyn Coulter, who's the Deputy Commissioner and General Counsel for the Missouri Office of Administration, to kind of talk about the process. Carolyn?
Thank you for that, Charlie, and also thanks to explain. I think for a lot of times when we come in, people are not necessarily aware of the administrative tasks, but from the Office of Administration, on behalf of Commissioner Ken Zellers and the entire Missouri Office of Administration, it's an honor to be here for this significant milestone. I'm going to go slightly off script of what I have here, just kind of in that same vein. I applaud. I think this is an absolute true example of what all levels of government, when we can get involved and we can take care of a need. I know, as we've talked about, as the hurdles. I do want to thank everyone at the city, at the state level, with the hospital, on overcoming and finding a lot of those solutions. And so we're very excited to be here finally at this day. So as the state's agency responsible for the capital improvement projects and our management of those properties, our role is to take the vision of a project like this and deliver the physical foundation. And today's signing is a profound step forward, allowing us to begin that critical work. The Office of Administration is proud to lead the construction of this much-needed facility, and we understand that existing facilities that the state has are unable to serve the citizens who need this specific type of care. Our task is to translate that need into physical reality, a responsibility that's going to be led by our expert team of the Office of Administration's Division of Facilities Management, Design, and Construction. They are tasked with delivering an estimated 300,000 square foot psychiatric hospital right here. Safety is going to be a fundamental guiding principle during that design and construction. Every aspect of the physical structure is being developed with the well-being of three groups in mind: the individuals receiving the needed treatment, the dedicated staff who are going to be providing that care, and the surrounding community. Our commitment to all of you is to deliver a secure, modern, and effective building designed to provide essential care for at least 200 Missourians, and hopefully maybe even more. I know everyone's touched on some of this impact, and I will try not to repeat any of it, but beyond its core mission here, we also recognize this facility is going to be a powerful engine for economic growth. As many have discussed, the project represents a total capital investment of $300 million in the Kansas City region. And during that construction, that investment is going to create local jobs, and every job created on-site, another job will be supported in the local community. As many have mentioned, this project is only possible through strong, sustained partnership, and we are deeply grateful to Governor Mike Kehoe, but as we also mentioned, the Governor Mike Parson was also supportive, but to the General Assembly for supporting its continued funding on this key project, to the City of Kansas City for making the site available and working closely with us through planning. And we're proud to partner with the Department of Mental Health, whose leadership and expertise will ultimately turn this facility into a place of healing. And to our partners at University Health, your deep commitment to care in this community lays the foundation for this hospital's success. With that, this facility is a direct investment in the health of our citizens, the safety of our communities, and the long-term economic vitality of Kansas City and our state. And on behalf of the Office of Administration, thank you. And with that, I'll turn it back over to you, Mayor.
Well, we are just about done, so we'll do some of the real work and do our signing. I will invite up the city manager, Ms. Coulter, Ms. Hume, and it doesn't seem right to not have Charlie Shields up too, but come on. All right.
Here we go. We're all set.